Hello everyone, I'm Queenie, and before we start, please subscribe to our channel so next time you will be updated with our new releases. Nowadays, women can change or adjust any part of their bodies that they don't very much like. Cosmetic surgery have made it easier to be more visually appealing and more satisfied with one's appearance. Some people may go for a nose job to enhance their facial features. Others, especially Asians, might go for eyelid surgery to adjust their eyelids and have a wider eye field. One of the most popular cosmetic surgery is breast augmentation. Many women have small breast size and they're not satisfied with it. Maybe they want bigger and fuller breasts for reasons that differ from one woman to another. Plastic surgery has helped those women to get what they want. Women can get what's called breast augmentation surgery, also known as breast implants or augmentation mammoplasty, to have the look they want and feel better about their appearance. However, breast augmentation is not considered a cosmetic surgery only. It can also be done for reconstructive purpose, such as after mastectomy for breast cancer. Our role today is to answer most of your questions regarding breast augmentation. Today we have Dr. Choi, who is a renowned cosmetic surgeon from Seoul, Korea. He's going to discuss with us about breast augmentation from an experience point of view. Hello, Dr. Choi. How are you?
Hello.
안녕하세요.
안녕하세요. Can you please introduce yourself to our audience?
I am Soon-Woo Choi, head of plastic surgery at View Clinic.
Thank you, Dr. Choi. So for my first question, how many types of breast surgery are there in Korea?
There are many types of breast surgery. It depends on why the patient wants one. If the person has small breasts, we can do enlargement. If the breasts sag, we can lift. And if the breasts are too large, we can do a reduction. And for cancer patients who lost their breasts, we also do reconstruction.
What is a breast lift?
Breasts can sag for a variety of reasons. Breastfeeding or change in weight due to a sudden weight loss or gain. If breasts enlarge then subside, they tend to sag. Lift surgery addresses that type of issue. Breast lift surgery can be divided into several types.
So in what cases does breast lift be done?
We cannot exactly say a breast lift is needed. If lifting will improve one's psychological well-being, sure. But if one wishes to enlarge without the lift, we must examine if the ducts are level with the nipples. If the mammary ducts are below the nipples, then we cannot simply do enlargement. It must be done together with a lift. We do try to avoid lift surgery, as it can leave a visible scar. However, if the ducts are below the nipples, then a lift is the recommended course.
How long does an implant usually last?
When clients come for a consultation and ask if they can change the implant every 10 years, today's breast implants are in their 6th generation. The first ones came out in the 1960s. However, do patients who had 2nd and 3rd generation implants change to new ones? No, they don't. If they don't burst, they can keep using. But since it is not obvious sometimes whether the implant burst, it is imperative that one gets regular exams. However, there were implants that were problematic. For example, allergens implants. Since they are not healthy, it is recommended to change it to a new one if one has the allergens implant currently.
Is it possible to have an operation while breast lumps or mastopathy?
At our hospital, we always perform ultrasound exams before surgery. Usually we implant below the muscle layer. Above the muscle, there is a mammary duct, which is prone to lumps or even cancer. If upon exam presence of cancer is detected, then we cannot perform implants until the cancer is first addressed at the hospital. But most people do not have cancer. If the growths are benign, we cannot do the surgery after removing them. Or if the size is small, it is better to leave it alone and perform surgery. So even if there is a lump, we can do the surgery without big issues.
Okay, for example, how to choose the best implant that suits me? What are your recommendations?
We perform breast surgery for over 1,000 patients each year. We constantly watch for the best implants, those that have low side effects. We keep statistics every year. We found that the micro-textured implants have the lowest occurrence of side effects. We know by material type and manufacturer. The shapes are different, and we can discuss which one may best fit your needs. Whether one wants a larger set of breasts is an individual choice. The doctor can help choose the type of implant would best fit the client's goals. So, a consultation is very important.
When can client return to sports after the surgery?
2 to 3 days after surgery, can start working at an office. In jobs that require the use of arms a lot, it takes about a week of recovery. For intense sports, it is best to recover for a month prior to doing so. For simple sports like jogging, it only takes a week of rest. So even if you visit from abroad, since it only takes a week's rest mostly, it is a manageable procedure for visitors.
Is it possible to breastfeed after implantation?
Yes, definitely possible. The implants go under the muscle tissue. Breastfeeding is no problem since the tissue is above the muscle layer. Breastfeeding and breast implant surgery poses no issues.
What are the limitations for breast lift surgery?
What cosmetic surgeons abhor are scars. But it is impossible to perform a lift without slicing off some excess tissue. The aim of lift surgery is to limit as much as possible the visible scarring. But if we limit the scarring, then the lift is modest. It is key to have a thorough consultation to best match the expectations with the appropriate procedure. This way we can limit the potential regrets. Since scars do not completely disappear, even with laser treatments, we must consult prior to surgery.
Is there any age limit for breast surgery?
Breast surgery can be done with anyone who's fully grown, about 2 to 3 years past full growth.
Today, many college students have them done, but also many around age 60 also have them done. All age groups of adults have them done. Younger ones tend to want to enlarge, while the older tend to want a lift. Breast surgery covers all those needs.
For my last question, what are the most common side effects after breast surgery?
Side effects of breast surgery are, of course, worrisome. The fact that a large foreign matter is inside coexisting with the body is a big deal. Whether the implant can safely coexist with the body is the big question. So we use our knowledge to choose the best implants. But even with that dedication, there are times when implants trigger side effects such as leaking, bleeding, infection, etc. In order to limit such problems, the hospital should be well equipped, clean. Also, the skill and experience of the surgeon is important. And the maintenance after the surgery, whether a high-quality implant is being used. All these matter and influence the results. I began doing implants about 20 years ago. Even back then, the issues were low occurrences, but today, they're even lower. This is a procedure that can be done without too many worries.
Lastly, thank you so much, Dr. Choi, for joining us today. 감사합니다.
Thank you.
There are many types of breast surgery. Depends on why the patients want one. If the person has small breasts, we can enlarge them. If the breasts sag, we can lift. And if the breasts are too large, we can reduce them. And for a cancer patient who lost their breasts, we also do reconstruction. Breasts can sag for a variety of reasons. Breastfeeding or change in weight due to sudden weight loss or gain. If breasts enlarge then subside, they tend to sag. Lift surgery addresses that type of issue. Implants are now in their 6th generation as the first one came to the market in 1960s. If all implants have no issues, there is no reason to have them removed or changed. However, there are issues that require attention, including leaking, bleeding, or infection. Also, some are known to be problematic, such as allergens implant. If a patient has allergen, it is recommended to have them removed and replaced with a safer one. As to the concerns for being able to breastfeed after augmentation, yes, it is no problem as the implants lie below the muscle layer, while the breast milk is generated above the muscle layer. Hospitals such as View Plastic Surgery perform over 1,000 surgeries a year, rendering a unique experience and know-how. Their experience allowed them to suggest the best implant and perform the surgery with precision. Breast surgery can be done by anyone who is fully grown, about 2 to 3 years past full growth. Today, many college students have them done, but also many around age 60 also have them done. All age group of adults have them done. Younger ones tend to want to enlarge, while the older tend to want to lift. Breast surgery covers all those needs. Thank you for joining us once again at CloudHospital TV. If you have any questions or comments, please leave it down below. We will respond to you as soon as possible.